As more COVID-19 vaccine appointments become available to people 65 and over, we know a lot of you have questions about the vaccine and some of the best practices for those who are getting their first dose. So joining us now to discuss is clinical nurse Alice Benjamin. As always, thank you so much for being here.
Thanks for having me.
Well, some are hearing that you should take a Tylenol before the vaccine. Is that good advice?
So, no, I know people are trying to offset that arm pain, that swelling, those aches that they might feel after the vaccine, but we're recommending that people don't take anything like Tylenol, aspirin, or ibuprofen before the vaccine, because there's actually some information out there that pre-medicating could potentially blunt the immune response to the vaccine and reduce the body's ability to build up defenses to the vaccine. So you want to avoid those.
So what if you're feeling a headache or a sore arm after? Can you take it then?
So if you are experiencing that aches, that pain that's just not going away, it's nagging, go ahead and take it. But we're asking that you just not prematurely take it ahead of time. And then also want to mention, if you're someone who takes these medications routinely, perhaps for your arthritis, you take a daily medication like this, don't stop taking those medications.
Okay, so we've heard about side effects from the vaccine. What are symptoms that you might be more concerned about that, might warrant seeking help?
Well, when it comes to the vaccine, and Kathy, how we were talking about not pre-medicating, it's going to be important that people don't pre-medicate with those medications we talked about, as well as other medications like Benadryl, because we know that there are a small group of people who may have severe reactions. It's estimated that 11.1 people out of every 1 million will have severe reaction to the vaccine. So we want to make sure that if you're feeling any itchiness, you feel like your throat is swelling, rashes, hives, or any kind of impending doom or something doesn't feel right, we want to make sure that you seek medical attention right away, because allergic reactions can appear differently in people, and some of them can happen right away within the first 15 minutes. These are the ones where your airways are closing, or they can be more subtle and happen over the course of 24 or 36 hours. So if you're starting to feel anything that's not your normal after the vaccine, we want you to get medical attention right away.
Okay, and people are waiting in long lines. Is it okay to bring food and drink and have some of that before you get the vaccine?
Absolutely. So actually, even before you get the vaccine, you'll want to get a good night's rest, eat a nice meal the night before, and make sure that you're hydrated. Some people, while some might be waiting in cars, some people might be standing in line, you want to make sure that you're not going to be tired or pass out for dehydration or low blood sugar. So eat and get good rest. And then also, when you go to the site, it wouldn't hurt to bring a bottle of water with you, bring an apple, a granola bar, something to snack on. And if you're going to a site where you're going to be standing for long periods of time, not a bad idea to bring a lawn chair with you so you could perhaps sit in line so you're not standing for prolonged periods of time.
Okay, I know we're getting to the end of our time, but let's say you wake up and you're not feeling quite right. You mean you're not really sick. Is it okay to go ahead? You've booked an appointment. Can you get the vaccine?
As long as you're not running a fever, you're not nauseous, vomiting, and you're still able to, for the most part, function, I would say go ahead and go to the appointment site. And then there's some pre-screening that happens before you get the injection. Talk to the healthcare provider, the screener that's there, and that you guys will then determine if it's a good idea for you to proceed with your vaccine or not.
All right. Great information that we can all understand as usual. Thank you, Nurse Alice.
You're welcome. Thank you.